All right, the third most common type of low back pain is the SI joint or SI joint dysfunction. S stands for your sacrum, which is at the bottom of your spine. This guy right here. Some people refer to this whole bone as your tailbone. I stands for ilium or iliac, and it's your hip bones. It's the rest of your pelvis that sits right here on either side. Okay, so S sacrum, I iliac, SacroIliac joint, and the joint between them. That can kind of be off a little bit. So notice how nice and straight your spine is here. Now, if we take this model of the spine and throw it over there, and we look at these blocks instead, okay, I bet you would tell me, if I asked you if these blocks are stable or unstable, you would probably tell me that they are unstable. And you're right, because this bottom block is off to the side, right? If we shifted this bottom block underneath the rest, it'd be a more stable structure. What we can probably expect is this bone wants to fall off this way, and then if this one falls off, like if we're playing Jenga, this bone would fall off this way, and these two would kind of come collapsing down that way. Well, just having this bottom block out of place can cause more problems up the spine. You can have, so if this is your spine, I'm going to draw in the discs here. Okay, so we're looking straight on at the back of your spine here. Okay, this bottom bone is your sacrum, and this is your pelvis. Okay, kind of can erase this in a way. That's kind of what it looks like. Okay, and so if this bottom bone is kind of shifted or it's kind of rotated, this bone can do all kinds of weird stuff. It'll cause changes up the spine here. And you might have an X-ray or an MRI that said your spine's out of whack. It looks like you have a herniated disc. But if you have an underlying SI joint issue, then you are, no matter what you do to correct these issues up here, if you have a herniated disc or arthritis, if you have an underlying instability at your SI joint, then what's going to happen is you're not going to be able to really fix these because you're not coming to the problem. Oftentimes, if we fix this problem area, if we kind of shift this block back to where it's supposed to be, then we can correct these. So the primary concern when anybody comes in with a problem with their low back, we have to rule out that this SI joint problem is occurring. So SI joint problems generally occurs in more active and healthy populations because they're moving around a lot. Oftentimes, when you bend over, you feel completely fine, and then on your way back up, you feel like a catch in your back, and you feel like a sharp pain. And it's not right in the middle of your back, it's kind of off to the side a little bit here. You can almost put your thumb right by the bone in your hip there. There's a bone that's like right off the spine, and if it hurts right there, right on that bone, there's a good chance that your SI joint is out of whack and it needs to be addressed. So oftentimes it hurts when you're sitting in the car, when you go to transition out of a car, when you're standing on one leg, when you're walking upstairs. It can also occur due to a recent pregnancy. While you're going through pregnancy or just afterward, there's a hormone that gets released in your body. It's called relaxin. It just makes all the ligaments around your spine kind of loose, and it can kind of allow things to shift. So this is SI joint, and needs to be ruled out before we can fix anything else. SI joint.